Can you see the answer?
Pathogens enter the
Uh,
bodies as antigen. Immune system, specifically white blood cells, produce antibodies as they detect foreign subcell. Antibodies then bind to the antigen. In the end, and these antibodies engulf the pathogen and destroy it. How? Engulf? Antibodies are just like the Y-shaped structure that's going to just attach.
wait. Then antibodies. In the end, antibody is like destroys it.
Yes, yes, to bind to the antigen and destroys it. But still, we need some improvement here.
Okay, so first point in okay, you can tell me in which point I need improvement. In the
Uh,
first, second,
in the
third,
in
or
the in
fourth.
the second, in the second, immune system,
Okay,
specifically white blood cells. Which white blood cells? Like we should also mention the white blood
lymphocytes,
cells.
lymphocytes,
Lymphocyte B lymphocytes
B lymphocytes. Okay, basically B lymphocytes.
produce antibodies
Mm,
and they detect the foreign cell. Foreign
It's
cell or
and
foreign particle? Foreign particle are the antibody.
foreign. Okay, we can say foreign cell. Foreign particle,
Foreign
right?
particle. Yeah.
Okay. So it was kind of like almost like 4 marks or three
Yes.
marks, I think.
Yeah. For more mark. It's a 4 mark question.
No, no, but yeah, but my answer that I wrote,
Uh-huh.
is it 4 mark? Not right
And
now, like before.
antibodies then binds to the antigen. You would say the specific antibodies then bind to the specific antigen. You need to
Oh
add
yeah.
the word specific.
Okay.
In the end, antibodies destroyed. In the end,
I think I need improvement in first point because it's
yes, in
too
in
like
fourth one.
general.
Yes.
Yeah. So um, firstly I wrote down that they engulf them, but I think it's you said it's not right. So oh, so do they like enter the cell and oh, no, no.
Mhm.
They break the like cell wall of the cell membrane of the foreign cell. Can you say that?
Uh, there is something, the number of steps that we can consider here, but the first step that we have mentioned, that's the recognition and binding, right?
Yeah.
Second is neutralization. That's in which the antibodies block the active sites of the toxins or any other like viruses, bacteria from binding to the host cells. I mean,
Mm-hmm.
inactivates. You would say inactivates the pathogen or toxin, whatever there is.
Mm. Okay.
In the third step, there's that we always use the word agglutinization or agglutination. That's called clumping,
Agglutination.
where antibodies bind to the multiple antigens at once, linking them together like
So what does
that's
it? What's the spelling of the word dissolved?
agglutination.
Yeah. Yeah.
Agglutination.
Okay.
Then after there's a precipitation. Soluble antigens like become insoluble when bound to the antibodies and precipitate out, making them easier targets for the phagocytosis. Then after you would say the phagocytosis after agglutinization, right? So
Yeah.
the constant region of the antibody binds to the receptors on natural killer cells, macrophages, and the neutrophils. I mean, these cells then attack and destroy the antibody tagged pathogen.
Mm.
That's what we
Mm.
should say. That's fine.
You can write the text and this. What is it? So you can. Okay. Wait. Okay. It's already there.
Now, this is already there.
Mm. So
In the end, the
aggregates
antibodies
in there
attack and destroy the
targeting
pathogen.
the
Yeah.
body's own cells. Why then?
The next question is,
When monoclonal antibodies destroys the cancer cells, they are targeting the body's own cell. Explain why this increases the risk of harmful side effects to the patients. So this increases the risk because monoclonal antibodies may target the healthy cells which are not causing the cancer, like which
yes.
are not a cause of cancer.
Mm,
So by doing this, they can like they can like just increase the risk,
mm. Risk of what?
of harmful side effects or any other like
Mm,
basically damages the person who is taking the monoclonal antibodies. So I can write monoclonal antibodies, wait, could destroy the healthy body cells. First, this is the first one. Wait, let me.
mm,
Yeah, that's the first point. Second, so we need to. So, um, this one is it? The because of that. Gole gole dum dum. It's my little brother. Sorry.
mm. It's happened this. What he's doing? In which class he is?
Oh, he's also taking his class from Grad Campus. He's just doing it. I don't know. He just came here for to get something. So
Mm.
he's in year six.
Year six. He's taking classes here
Yeah,
and with
yeah, yeah,
YCF. Okay.
yeah. So it can increase the risk of harmful side.
Mm.
How is it?
Monoclonal antibodies could destroy the healthy body cells. Because of that, there would be effect on the person's body or health. No, it's quite general.
Yeah, first point is definitely good, I think.
Yeah. First
Yeah,
point is what? Monoclonal antibodies could destroy the healthy body cells.
yeah, that's 1 mark, sir.
Yeah,
Yeah,
that's for we can mention
yeah.
um,
What?
because
I'm
that there
confused.
would be because
Yeah,
that there would be the effect on the person's body or health, so it can increase the risk of harmful side effects. Mm, okay.
yeah, but
Second point, that
so
how we can improve the second point.
yeah, that's what I'm asking because I know like they can affect the healthy body cells, but
Mm,
so I can write that the monoclonal antibodies could bind to the healthy body cells, which no, basically no. I have said that in first month.
mm.
No,
Says it.
I don't know about this one. So you can explain the second point, please.
Second point, like what you have mentioned here, because of that, there would be an effect on the person's body or health. But how? That's we need to point out here. Like triggering the immune response, immune reactions. It's possible like it may trigger the immune reactions because the body may recognize them as a foreign. Sometimes this is what like immune system sometimes wrongly recognize the own body cells as a foreign particle. So that's actually triggering the immune response. There, what you can add that here in this second case, because of that, there would be effect on the person's body or health due to the
Okay.
immune response, or because of the triggering of the immune response.
Done.
So all the allergic reactions, infections, organ toxicity, immune overreactions, resistance. So this all is because of, you would say, um, this factor. So there are some instances where the body does not recognize the antibodies as human, and it triggers the immune system to try and to destroy them. So using your knowledge of how monoclonal antibodies are produced suggests why this is the case.
Oh, okay. It's the second. Oh, I thought you were explaining the first one. Sorry, sorry.
Yeah,
Sorry,
we
sorry. I'm
should be.
sorry.
That's fine. It's
Another
correct.
immune response
Now
that
you
can
should go for the
go.
next one.
So, the past two question was they good?
Yes.
Mm,
Yes.
The answer
Great.
was good from me or not?
Yes. Yes. Great. There are some instances where the body does not recognize the antibodies as human and triggers the human response. Okay, using your knowledge of how monoclonal antibodies are produced suggests why this is the case. Yeah.
This is just one mark. Okay.
Hmm.
So, monoclonal antibodies are produced like uh like they are produced from like loads of clone of like a single which you say like single white blood cell. So this mean like this can mean they like they are like identical, but I think I don't need explanation for this because it's just one mark, so I can just write
Hmm.
um okay mono and
Production of monoclonal antibodies.
from lots of clones of
Monoclonal antibodies are produced
white blood cell, like they are clone
by
of
by
a white blood
fusing.
cell.
We have discussed one of
Yeah,
the
yeah.
questions yesterday. B
Which?
lymphocytes with a myeloma cell to form a hybridoma,
Oh my God, yeah, I forgot this is just one more question.
which is cloned to make identical antibodies.
Okay, so we can write fuse a mouse, like B lymphocyte with a mm,
With myeloma cell to form a
like
hybridoma. Yes.
tumor cells.
Mm.
Okay, antibodies.
Mm.
My antibodies are not good. I get sick every month.
Really? Oh, God. I mean, your immune system is not up to the mark. So you should, what one can
No,
do
I'm
to.
joking. I'm joking. No, no. Sometimes, there was one year I didn't even get sick in the entire year.
Mm.
Sometimes this like, I'm just too strong.
Yes, you should do to make your routine healthy, like exercise, good diet, fruit, fish, and all of these things, and
Yeah,
especially vitamin C. Like to have different fruits. That's a source of it. So immunity can it's a multifactorial. I mean, way to address or to boost this.
yeah. So I have written the answer.
Monoclonal antibodies are produced by fusing mouse B lymphocytes with the tumor cells
Is it right?
to make a hybridoma, to form a hybridoma. which is cloned to make identical antibodies.
Okay, okay. But also, okay. But what would be the reason? So they said suggest why this is the case.
Oh, yes. Why? There are some instances where the body does not recognize the antibodies as human, and it triggers the immune system to try and destroy them. Because of the immune reaction, I mean, we have mentioned before as well. Like in some cases, um,
Yeah, immune
these
system, like,
sometimes
yes.
monoclonal and monoclonal are the antibodies, human antibodies are the proteins the body may recognize them as foreign. Actually, this is because of the triggering of the immune response, and that's why I would say that does not recognize the antibodies as human, and it triggers the immune system to try and destroy them. There are some
Mm,
instances, there are some examples where the body does not recognize the antibodies
mm.
as human, and it triggers the immune system to destroy and uh, try and destroy them. Oh, yes.
Oh yes.
Yes, it's possible.
Oh yeah.
But how?
Because the body it doesn't recognize the the monoclonal uh, antibody, and it triggers the immune cells to destroy to try destroy them. This one was definitely not good. Okay. I have written the answer, sir. This has been a stumbling block preventing the widespread of use of immunity in a way that was predicted when they were first developed. But how the use of antibodies in the medicine. I can say that monoclonal antibodies are used in pregnancy tests and yeah. Oh yeah. So I also like identifying the pathogens and in laboratories like they use them for like find specific substance
Hmm.
or they can yeah research and yeah oh yeah they can be used to treat diseases. So
Yes.
what I'm thinking, I can write first the use and then a little bit more like, so I can write monoclonal antibodies can use to treat disease
Yes.
and for especially cancer
Yes.
because
Great.
yeah because it's hard to treat and then I can write on every point I can write the reason.
Hmm.
Yeah. So mono, can I just write MA because it's so big?
Yes. Okay.
Mm, Try to quickly answer it so we can move on.
Hmm. Okay. May to be honest, I just want.
Yes, what happened, sir? You need food.
No, actually, send me something like it's not. You know, tea is like um I don't know what's your practice are. what your father is doing, but most of the time, tea should be good because we don't. Uh,
Yeah, I agree. Because people
mm,
take tea to like reset their mind and get fresh. And if you don't like the tea, you're gonna get even worse.
yes, because we don't compromise on the quality of tea. So
I
this is
also sometime I make tea, but
mm,
whenever I make it, it's really good because I don't make it like from the normal
mm,
in Urdu we call it patti. So I
mm,
don't make it with the normal. I just make it like with the sometimes they have like packet like
mm,
for 1 glass you can get this packet.
mm.
So we have like packet for Kashmiri chai and ilachi chai. So
You people are from where? Basically, from which region of Pakistan?
Punjab,
In Punjab, which they
Punjab, Bahawalpur.
Bahawalpur. So they people are. I think they are. What's more famous there? Like in Bahawalpur,
In Bahawalpur,
I think they were. There is some academy was there in Bahawalpur or not? No, just like a Kakul. I think there is some army sort of. That's a region where army influence is more. Like they have more units. I don't know. There's something.
oh, okay.
The training
Do you know?
center.
Yeah, yeah. Do you know Noor Mahal? It's in so
Yes.
Bahawalpur is basically it's called
Mm.
Nawabo ka Sheher.
Yes,
So
yes, 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 yes. I got it. Hmm.
there's Noor Mahal which is like so much army there, and beside Noor Mahal there is a big like army
Ah,
tent,
yes,
army
yes,
camp
yes.
or tent. I
Kant,
don't know
Kant
what.
is there. Yes, yes, yes.
Yeah,
I got. All right.
it's really good. Like there are so many army forces, so we are
Hmm.
safe. If we ever go to the city.
Yes. All right. All right. So when you visited here last time?
We just came here like 2.5 years ago.
2.5 years ago, you people just
Yeah,
shifted from Bahawalpur
yeah,
to UK. Okay, great. Mm.
yeah.
Example bind to hormones and other chemicals. What's that? Evaluate the use of monoclonal antibodies in medicine. Monoclonal can be used for the treat diseases. For example, cancer can be used to in laboratories. And yesterday, I was reading one of the reports like Russia has synthesized the vaccine for cancer. You should ask this to your father.
Oh,
Like he may know about it. Like Russia is uh, and very effective. Like that vaccine is quite effective. They have just made it, and that's I mean have the very good results for the cancer treatment. So yes, immune system was actually very recent approach to address or to treat the cancer cells. Previously, they were not thinking like this is something that we can use for to treat the cancer cells. Immune system is somewhere like we if we design our immune system in a way like that can recognize those specific cancer cells, so we can.
yeah. So when the time goes by, the content also changes from biology because so now you said that Russia has invented the vaccine for the cancer. So
Yes.
after 1 2 year, when it will be official, then
Mm.
they will put it into GCC. Then the
Yes.
content will change, and then
Yes.
in the A level they will make an entire topic and they will say how a cancer vaccine can be made.
Yes, that's the beauty of these exams, especially in O levels or GCSE, because they always
Mm.
keep in mind that the modern trends. Unfortunately, I'm not teaching this other like metric FSC,
Big classes.
but yeah,
Okay.
but they people have. I mean, their syllabus is such a stupid. Like uh, this is the third generation. The third generation is studying the same syllabus. You just imagine how it's possible. Like things are getting changed with the
So
passage of
they are
time.
not updated.
Yes, they are not updating. Like for instance, this is the very like this one. If you are teaching to a student of the cancer topic, with the same approach that you have 20 years back, so I think that's nonsense.
So
Today,
it's in Pakistani school or what we
yes,
talking?
yes, most of the schools that in Pakistan, especially they are. dealing with the same approach. Other than I'm talking OE levels is a bit different, but this is what the approach that I think that is in other side
Mm,
of it. And this should not be. And
mm,
you people should be quite aware about this. Like, what are the modern trends? And sometimes we even don't know, but sometimes they also include, although they can't go out of the course specification, but if you have the modern that advanced knowledge, so you can also give that example there somewhere in the answer. So they will appreciate it. Okay, he knows the modern trends as well. So that's a good thing. Like once.
what if the examiner doesn't even know?
What? But I think examiners are because they are quite attached
Yeah,
to
yeah,
the modern trends. Everything that's good, like suppose this one, it is published in many recognized journals, and
yeah,
specifically
yeah.
in the scientific community as well. So they are
Mm,
because they
yeah, yeah.
used to become
So,
part of it.
I have a website where me and my brother can like listen the lectures. So it is in the lecture in the website also like high quality lecture. Every teacher is like this. Their website people say they are the world class teachers. So one of the best teachers like in our in UK.
Hmm.
Because for the biology teacher, he said he is like his qualification like he's from like Queen Mary University,
Hmm.
and like he got nine. I don't know how what grade he got, and also he teaches like in the best school in London. He says I don't know what's the best school in London. I don't. And also he said he is the examiner also. He's like he did every teacher there is like examiner of what subject they teach.
Yeah,
So
recognized examiner. This is because in all over the world, this is the common practice. Like especially in Cambridge exams, they used to have. You must be qualifying their standards. Like for instance, if I'm doing my PhD right now, I'm doing research in that specific, I mean, neurosciences. So yeah, they will consider me like just to for such things in Pakistan, especially in for OE levels for CEI board. Like they used to have this, and we can apply for that. I mean, that's not something like that's out of approach. Yes, you should have an idea like how to design the questions. That's the trick that they always have. I have one course for there. I'm trying to get that certification as well as soon as possible. So they used to teach us how to design the questions, camera CI board questions, and what's your approach that should be while checking the paper. So we are working on this. Hopefully, in 1 or 2 months, things will be on the positive side.
mm, okay. So happy paste is the next question.
Evaluate the use of monoclonal antibodies in
Oh
medicine.
yeah, I have done this one. You can see it. You can see it. You can mark it.
It's to find the specific substances like uh suppose that
Specific mean
that's ELISA. ELISA is one of the examples, but we have many other examples where we antibody antigen approach that we can use for uh to find some specific antibodies to specific hormones especially, and yes, that's fine. Or using pregnancy tests, they bind with HCG, 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 HGC. What we have written here?
HCG.
It's H. You have written here HGC.
No, HCG is it's HCG.
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 So
Oh
what
no
is
no
here?
HGC.
HGC.
Yeah. Oh no, wait. So what are you saying? What did you said? So what did you
H
said?
HCG. HCG is what?
No, it is
H
HGC.
HGC. HCG is human chorionic gonadotropin. That's we always have in our mind. So HCG is uh
Oh,
it's a
sorry, it's
it's a,
HCG. Sorry.
it's a pregnancy test.
Yeah.
Getting
Yeah.
HCG because for
HCG.
pregnancy test we have this one. We used to have this separate. Okay,
So.
Then after
Right now
we
I'm
have,
scared. Right now I'm scared that Sir Jamshed will come again.
no, no, he'll not come again that day because because we had to complete it. You know, it's a sort of disturbance while in the class.
Yeah, yeah.
It's not a good practice. I used to tell them like this is not a good practice. If you want to get some specific feedback, you should ask them to get into
After the
your
class.
after the class
Yeah.
and get into your room to discuss all of these things.
They literally have like our numbers. Why don't they like just call us or message?
Yes, I don't know. This should not be like you should even your father should tell them like try to have the approach in a way like if you have any problem, any concern, so you can discuss with me. So we will have this idea. Otherwise, this is some sort of disturbance in the class. Uh, because not in one class, I don't know, you have many other classes that you are taking with other teachers, so they used to get jump into that class again to disturb the teacher and student as well.
Yeah. So you know
I used to
when
react when they did such
yeah
things. That's what they,
when a
yeah.
third person comes in the meeting, like it just feels a bit like मतलब अजीब लगता है थोड़ा सा मतलब कि भाई
Yes, definitely.
हम्म
It's unprofessional, sort of thing. So if somebody is going in the same pattern, so you just interrupt it there and destroy everything. So it's a concentration. That's why we always, whenever you are studying somewhere, even in the home at home as well, what you should have a practice like we always do. There should not be any noise in the surrounding. Nobody should come to disturb us, so that we can focus. Because focus is something once it takes time to concentrate on something. Once you're getting deep into that, and somewhere if somebody comes to disturb you and to destroy that concentration gradient that you have developed, so in other words, like you will take a lot of time there to get back to that specific, the same concentration, the same focus. So that's the psychology. If anybody who has this sense, so he should understand like this is not the practice. Like you should wait once your your work is completed. Then after you can have some interaction, and even we should learn these manners as well somewhere. Suppose if we are doing at home or somewhere, if somebody is doing work, we should try not to disturb until he or she is not getting completed. So this is what we should learn. Unfortunately, this is not the common practice here. You know better about this as well in the sense like this professionalism and mannerism is not too much good practice. Uh, so the other question that I should take, which one, Abdullah? I think explain why why this increases the risk of harmful side effects of the patients. This is what we have done. When monoclonal antibodies destroy the cancer cell, they're targeting the body's own cells.
yeah
Done.
yeah we have done this one.
Okay, should I give you some bit hard question related to this as well? I think we have done this
Yeah.
before yesterday as well. So it would be easy, why this is today questions are easy for you just because you have practiced on the medium questions, and you will see in medium questions many of the questions that you have done which are coming again with you bit different more requirement or more information or somewhere with advanced concept. Suppose I'm giving you one more question. This is also the very same question that we have done yesterday, uh, but not same in the sense. Oh no, I think before that I should give one more. I should start with, and one of them will come there. Suppose I'm giving you this one. Abdullah, here it is. We'll try to have work on this today. Like, don't know ways like, and I can give you extra time. We should. Do you have any other class, Abdullah, just after
Yeah,
this?
yeah, I have just after another class. You can,
Oh,
you know what we can do? We can
yes,
get 12 minutes from Abdurrahman.
yes, yes. But I'm saying like what I can do right now. I just wanted to give you extra time, but you have one more class or two more
Yeah, yeah.
classes?
I have two more classes. So I have on just now after this hour and on 2 o'clock.
But not just after this class.
I have one on 8 o'clock just
Okay,
after,
just
and
after.
one
Okay.
and two and like I think two on. 2 o'clock and 3 o'clock. I have to.
Okay, okay, all right. That's fine. Zika virus is the type of pathogen that spreads in most cases. You know, Zika virus was actually this is updated like in 2017 or 2016. Zika virus was discovered. So it's a type of pathogen that is spread
So,
the most cases
is
via
there
bites
any
of Aedes
coronavirus
mosquito.
in GCSE?
Yeah.
Is there any coronavirus in GCSE?
Yes, they have included somewhere. You will see in A levels. Yes, we are giving this. I mean, use many of the questions where the
Oh
coronavirus
yeah,
is
okay.
included.
So it's the like easiest question you can give. So we can wear a mask to spread the air contact, spread the pathogen by air,
Uh,
and we can also regularly wash the hands. That
yes.
you told me yesterday.
Mm, mm,
So it's 2 marks. We can don't have to
mm.
we don't have to waste too much time.
Suggest a reason why this
In,
is the
s-
case. Again, in second case.
in some people. Gigabyte produces very mild symptoms such as fever and a headache. Most people experience. So, are you gonna watch India vs Pakistan tomorrow? The most severe consensus of Zika virus occur. Hello, sir. Hello.
Yes, yes, I can hear you,
Okay,
Abdullah.
so are you gonna watch India vs Pakistan tomorrow?
What's Pakistan tomorrow? Like, sorry.
India vs Pakistan cricket.
Oh, yes. But I have a
You
lot
know
of
they're gonna
lot of other
lose.
engagements. Even tomorrow, I have one class of about 3 hours with one of my Canadian students,
Oh no.
and 2 hours class with another student from UK, OCR biology. So I'm even busier. Because uh, I used to utilize my weekend in this way. Not every time, but yes, tomorrow I'll see what I can do. The most severe consequences of Zika virus occur in the babies of the mothers who were infected with Zika virus during pregnancy. How you would answer? Suggest a reason why this is the case. Do
Just
not
wait,
develop
I'm reading
correctly
the
in the
last one.
womb, born with small brain and heads. Microcephaly, um, that's that's the case. Sometimes born with the small brains and heads, as well as other potential life-threatening abnormalities. The babies do not develop correctly in the womb and are sometimes born with the same brain and you should understand the consequences of the Zika virus occur in the babies of mothers that were infected with Zika virus during pregnancy.
So, oh yeah. So, if the mother is infected with Zika virus, obviously the virus enters the body and it attacks the cells.
Mhm.
So it would have attacked the pregnancy cells and have destroyed the pregnancy cell, causing in some harm side effects
Mm.
on the baby. Is it a good answer?
Mm. We just write down then after I improve it.
Okay. Oh,
Zika
okay.
virus
Just
is
1 minute
infected
left.
pregnant. How?
Zika, Zika.
Okay. Transmission to the baby. Like once the Zika virus can cross the placenta and if infect the developing fetus, this is called vertical transmission. Effects on baby, microcephaly, brain damage, eye effects, all of that.
Yeah.
Pregnant mother is infected with Zika virus. The virus can cross the placenta and cause congenital Zika syndrome in the baby. So just a reason
So,
why this is the case.
yeah, I'm just writing them
These
cause.
circumstances make it difficult to develop drugs to protect unborn babies from the effect of Zika virus. Hmm? Make it difficult to develop drugs. Hmm. Why? Because Zika virus is in the mother.
Oh,
because of the you
fine.
should say because of the vertical transmission. Getting Abdullah?
Yeah, yeah. Okay, done
Done?
it.
Done?
Yeah, yeah.
What's the answer? Are you satisfied with this? Zika virus enters the body and it destroys the pregnancy cell. Because of the vertical transmission, it is difficult to develop drugs. Hmm. Suggest a reason why this is the case. Okay, I mean, you have to explain this one, like why it's difficult to develop a drug.
Because of the vertical transmission.
How vertical transmission is, I mean, work.
Vertical transmission means
How
it means
how
like
how it is responsible for this? This is what I'm trying to understand.
because the Zika virus is in mother, not in the baby.
Okay, so
So
so we can't develop a drug by which we can stop this in the mother, and so that we can stop in the baby as well.
no,
So
no.
if we can stop the vertical transmission from mother to baby, it's not possible because in unborn baby definitely it's getting all of the I mean feed from the mother. Blood is even circulated from there. So I think it's not possible to develop drug in such circumstances. When when the I mean important role is playing by mother.
Yeah.
So if the pregnant mother is infected with Zika virus, so virus can cross the placenta and cause the Zika syndrome in the baby.
Okay.
So why we can't develop a drug?
So basically, it okay. So so basically, I think I'm not understanding it. Develop the drug. So develop the drug mean uh we can't give the drug to the
You know
baby.
why? You know why? Because of the
Why?
placental barrier. Many drugs cannot cross the placenta to reach the fetus. That's one of the things. Like it's not easy for us to develop any of the drugs so that can cross the placenta. Placental barrier that will allow only that substance which is required for the baby, right? So that's a placental barrier as well. You would say you should mention this placental barrier. You should mention because
Hmm.
drug cannot be developed. It is difficult to develop a drug for baby because of the placental barrier. Many drugs cannot cross the placenta to reach the fetus. If they do
Hmm.
cross, they may also affect the mother's tissue. I mean, that's a complication. We should understand this, right?
Okay.
Okay.
Okay. Yeah. Uh,
So remaining questions I will upload on your portal,
so that there is a percentage barrier. Okay.
and
So what
you
should I
have.
write?
Sorry. Yes,
What should
it's
I write? Anything?
no. I think that's fine. As there is a placental barrier. Placental barrier is the key word here that we should mention. Uh, that's why we can't. It is difficult to develop a drug to protect unborn babies, right?
Hmm. Okay.
And
Okay.
okay,
Yeah.
okay. Let's conclude this, Abdullah, for today, and I'll upload some of the
Hmm.
questions, some of the remaining hard questions on your portal. So please visit there during this
Okay.
week and try to attempt them. And I would appreciate like if you re-upload them again on the portal so that I can check and to discuss in the class as well, right? So that
Okay.
this is how we'll be able to complete maximum things. We will just cover many things from there. Okay, that's all for today. Take care of yourself. Bye bye.
अल्लाह हाफिज
See
अल्लाह
you. Allah
हाफिज
Hafiz. See you next week. Take care.